This is part 4 of a 4-part series on technical assistance for success to provide a high-level overview of becoming a CDC-recognized deliverer of the National Diabetes Prevention Program Lifestyle Change Program. This segment will discuss improving outcomes using data results. Diabetes Prevention Recognition Program, DPRP. The Diabetes Prevention Recognition Program, or DPRP, grants CDC recognition to organizations that have demonstrated their ability to deliver successful, evidence-based lifestyle change programs that help people prevent or delay type 2 diabetes. Data submission results. You can use the results from your data submissions to improve your outcomes. By comparing your organization's outcome measures to the requirements listed in the current DPRP standards and operating procedures, you can identify your strengths, weaknesses, and opportunities for improvement. Here are some tips to help you get the most out of your data. Session attendance. Keep up session attendance. This is a very important component of the program, and if overall numbers are low, your organization may not achieve full recognition. Participants who don't attend regularly are less likely to meet their weight loss goals, which could also impact your progress in achieving full recognition. The program lasts 12 months, and organizations must hold a minimum of 16 weekly sessions during the first 6 months and a minimum of 6 monthly sessions during the last 6 months. Attendance tends to fall off during the last 6 months, so this is a critical time to keep participants engaged. Program intensity and participant retention. Organizations that offer more than 16 sessions during the first 6 months and more than 6 sessions during the last 6 months find participant retention and attendance improve significantly. Some organizations have found that if they finish the weekly sessions early, offering sessions twice a month in months 5 and 6, and then continuing this in months 7 and 8 can help ease the transition to monthly sessions. Holding sessions more often can help to build continuity and cohesion among participants, facilitating peer support and peer learning. Holding an introductory class or session 0 before the first session is another strategy that's worked well for some CDC-recognized organizations. This gives the lifestyle coach an opportunity to explain what the lifestyle change program is and its value, describe the time commitment required, and set expectations for potential participants during the 12 months. And for some organizations, creating participant non-binding contracts has worked in keeping up attendance because it's a tangible way to help people stay accountable. As an incentive for retention, organizations will be granted an additional 2 years of full recognition for a total of 5 years if, at the time full recognition is achieved, certain retention criterion is met. Makeup sessions. Offering makeup sessions for participants who miss a regular session is also key to reaching your attendance goals. In addition, there's a proven relationship between the number of sessions attended and success in meeting both increased physical activity and weight loss goals. Every organization, class, and participant is different, so it's up to you to decide the best way to deliver makeup sessions. They can be held over the phone, through distance learning, or by using some other online method for the convenience of the participant. No matter which method is used, makeup sessions must be at least 5 days apart to maintain the intensity of the program, approximately 1 hour, and use a CDC-approved curriculum module. If you have an emergency outside of the normal processes and procedures, please contact the National DPP Customer Service Center for more guidance. Participants can self-report their weight at makeup sessions and should be prepared to report their physical activity minutes performed during the week leading up to the session that was missed. Eligibility. Participant eligibility can be determined in a few ways. 1, by a blood glucose test done within 1 year of participant enrollment, meeting one of the following specifications. A, fasting glucose of 100 to 125 milligrams per deciliter. B, plasma glucose of 140 to 199 milligrams per deciliter. C, HbA1c of 5.7 to 6.4%. Or D, by a clinical diagnosis of prediabetes or history of gestational diabetes. Or 2, through a positive screening for prediabetes based on the prediabetes risk test online. Participants cannot be pregnant at the time of enrollment. Participants who enter your program based on a positive score on their risk test should be encouraged to follow up with their healthcare provider to get a diagnostic blood test, which is required for a firm diagnosis of prediabetes, and report the results back to their lifestyle coach. You should strive to have all participants get a blood glucose test before their last session. If someone enters on the results of a risk test, as long as they receive a blood glucose test diagnosis of prediabetes before the end of the program, your organization will get credit for a blood glucose test. Documentation. Throughout your program, it's essential to document each participant's weight and physical activity minutes at each session. Keep in mind that some people are more comfortable being weighed privately. And remember, weight can be self-reported if a participant is attending a makeup session remotely. Documenting weight and physical activity minutes are important parts of the program. So, even if a participant has a week with very little activity, encourage them to write it down, even if it's only 10 minutes. But if a participant has a week where they just couldn't do anything, make sure to record that as 0. If your physical activity reporting is low, make sure you're entering minutes correctly. Weight loss. Meeting that overall weight loss requirement is important to achieve full recognition and to help your participants meet their goal of preventing or delaying type 2 diabetes. Emphasize that people who attend class regularly and stay in the program have been shown to reach those goals. It usually takes longer than 6 months to lose 5 to 7% body weight, and attending maintenance sessions is key. To help the larger group, ask participants who are achieving their weight loss goals to share their experiences, with a special focus on barriers and challenges they have encountered and what they have done to overcome them. Individual challenges. You're encouraged to devote time to exploring participants' individual challenges when it may benefit the larger class. Use sessions for peer learning and problem solving, and seek input from your organization's lifestyle coach. Data monitoring. Be sure to monitor and evaluate participants' data on a continuous basis between each data submission. The DPRP data portal features evaluation reports that help with monitoring data. By using data to identify areas for program improvement, adjustments can be made as needed, leading to better outcomes. Reviewing data on an ongoing basis also helps you see trends and identify any individuals who are having challenges meeting their goals. The lifestyle coach can then provide additional needed attention and support. For instance, if you open your report and your weight loss documentation numbers are low, below 4% halfway through the program, individual counseling might be appropriate for participants who are struggling. Data evaluation. CDC evaluates each organization's data against the requirements in the current DPRP standards to determine recognition status. All requirements must be met to achieve full recognition. Evaluation reports. Evaluation reports are generated after your organization makes its regular data submission to CDC. In the guidance section of the DPRP standards, you'll find an example of the path to evaluation for one organization and calculations for weight, physical activity, and HbA1c reduction. Using this example to analyze your data before submitting to the DPRP can help you address any data concerns if there's time. Continued data submission. Even after your organization has met all the requirements in the DPRP standards and achieves full recognition, you will continue submitting data regularly according to the current DPRP standards to be reevaluated for recognition status. Be sure to refer to the DPRP standards for more guidance and tips on successful data submissions and ways to avoid common issues. Your successful program. After all, the success of your lifestyle change program can encourage other organizations to participate, recruit more participants for future classes, and ultimately help more people prevent or delay type 2 diabetes. Whether you need technical assistance or guidance in making adjustments, or have questions about any part of the DPRP, please reach out by visiting the Customer Service Center at nationaldppcsc.cdc.gov and submitting a technical assistance request. To submit a request, you'll need to complete a brief profile by selecting Login and then Register. Once logged in, select Contact Us, Contact Support on the homepage. Thank you. And remember, CDC is always available to help guide and support you.